let's relate this to our inspiration example. With inspiration, I told you that you're going to have a decreased blood volume in the left side of the heart, but in the right side, you're having an increase. So if you have a decreased blood volume, you would expect the murmurs on the left side of the heart to normally be decreased in intensity. In other words, you won't hear them as much on auscultation after they do the method of a deep inspiration. But in the case of mitral valve prolapse and hypertrophic obstructive cardiomyopathy, a decreased blood volume actually increases the intensity. You have to memorize that. That is the weird exception for this whole thing, okay? If you can memorize this detail, everything else is simple. You've pretty much figured everything else out, okay? So, I've written out the stuff on inspiration. Now that you have all the concepts, and I kind of went on a tangent explaining everything, now everything else is really easy after this. So, let's look at things. Valsalva method. Valsalva is when you take a deep breath and you go to exhale the air out, but you keep your mouth and your nose closed. So you're basically trying to force the air out, and it's tensing up all of the muscles in your in your chest and your rib cage wall, and all of those muscles are tensing up, trying to force the air out, but it can't. And what does this do? This increases, Valsalva method increases your thoracic pressure, or your chest wall, or your chest pressure, all the pressure inside your chest. Well, what is that going to do? Remember the thing I told you earlier. Say this is our guy, and here's his chest, right? And blood is returning from the venous system back to the heart, which is in your chest. So if you're increasing the pressure a ton, if you're increasing this huge, like way more than it's supposed to be by tightening up all your muscles and basically keeping your mouth and your nose closed when you're trying to exhale out, that will increase your chest pressure, and that will basically decrease blood returning back to the heart. Decrease blood back to heart. Now, what is this not going to do? What this is not going to do is decrease your blood. What this is not going to do is basically do that weird thing like when I said about the lung thing. Remember with inspiration I said that that'll expand your lung volume, therefore you have a decreased blood supply in the left part of your heart, but you'll have an increase in the right. It's nothing weird like that. Valsalva is very straightforward. You increase thoracic pressure, you will then decrease the total blood supply back to the heart. Therefore, it doesn't matter whether you're on the left side or the right side of the heart, all blood is decreased. On the left and right side, all the blood supply is decreased. What does that mean? Well, now, if you do the Valsalva method, that means you are decreasing the blood back to the heart, so all murmurs of the general murmurs should decrease in intensity because there's not that much blood now flowing across the valves. There's less blood, right? Because we're doing the Valsalva maneuver. The only exception is what I was saying earlier. There it is again. Mitral valve prolapse and hypertrophic obstructive cardiomyopathy, HOCM. Those are the weird examples. So all murmurs decrease, right? But the two murmurs that are opposite of what we've been learning, the two murmurs that act very strange is these two. And so all the other murmurs will decrease, but MVP and HOCM, those two pathologies, those murmurs will increase with less blood. Those are the two weird ones. Just make sure you memorize that, okay? So in the case of Valsalva, all the other murmurs will decrease, but these two will increase. Why are these two situations happening? Because in Valsalva, we're increasing the chest pressure, and when you increase the pressure in the chest, that is thus increasing, it's making it harder for blood to return back to the heart, so we have decreased total blood returning to the left and the right side of the heart, and thus a decreased blood volume will cause decreased murmur noise, make them kind of not as loud. So the intensity of the murmur should go down, except for in mitral valve prolapse and hypertrophic obstructive cardiomyopathy. Okay, so that's Valsalva. Now let's go on to number 3. See, once you got the concepts, this goes a lot faster. Abrupt standing. Let's look at abrupt standing now. When you abruptly stand up, it's super simple. If you're sitting down, right? Say this is a person sitting down on the ground. I'm really bad at drawing, sorry. And this person abruptly stands up really fast. What's going to happen? Well, all gravity is going to basically pull the blood all into your venous system and make it harder for blood to get back to this patient's heart, right? It's all the blood's going to be sitting down at the lower part of his body. Now, what will eventually happen after a couple seconds, if the patient's nervous system or autonomic system is working correctly, is the sympathetic system will constrict the blood vessels when it realizes that, oh my goodness, like we have less blood coming to the heart. So a sympathetic response will constrict your blood vessels and send and help to get blood back to the heart. But when you first abruptly stand up, that takes a couple seconds, and you basically you'll be able to see a change in murmur before the loudness of the murmur before that happens. So when we stand up abruptly, it makes sense that all the blood's in the venous system and is struggling to get back to the heart. So you have a decreased blood volume back to heart. Do you see how blood volume back to heart? Do you see how this is exactly like the thing we just covered? We just covered valsalva, where you increase the thoracic pressure. That decreases blood volume back to heart. In this situation, abrupt standing does the same thing. It just does it in a different way. It pulls blood in the venous system, and the vessels didn't get a chance to constrict yet from the sympathetic response that's going to happen eventually from autonomics. So in this situation, same exact thing. Lower blood supply to the entire heart is going to mean decreased murmur intensity. It doesn't matter which one you pick, except for those two exceptions. It doesn't matter which side of the heart either. It can be aortic regurgitation, aortic stenosis. It can be mitral. It can be something on the right side of the heart. It can be tricuspid stenosis, tricuspid regurgitation. It doesn't matter which one. All of these will decrease the loudness of the murmur will get quieter, basically. The sound of the murmur will get quieter when you auscultate it. If you were to have a stethoscope and be listening at that particular valve, wherever the murmur may be, it will get quieter when they abruptly stand up. Okay? But the two exceptions is that you're going to have an increase in the intensity for mitral valve prolapse and for HOCM. Remember, those are the two weird ones. Okay? So that's it for abrupt standing. Now let's look at the next one. The next one I talked about. The next one after this one is going to be squatting. Now squatting is just going to be, this is common sense. You're standing up and then the patient squats down. Okay? Now the patient is squatting. When you squat, you are basically, think of it as you're constricting that lower part of your body and you're forcing blood back into the heart. Okay? So what is squatting going to do? It's going to increase your blood volume in your heart for the whole heart. The other thing, though, that squatting does is that squatting also increases your peripheral blood pressure. And what do I mean by peripheral blood pressure? Well, if this is a person, I had to make this bigger so you can see. Obviously, his heart's right here, and we have squatted down. So it has constricted all of this part of the body, and it's forcing blood. It's basically cutting this part of the body off. So now it's shooting blood back up to the heart, right? But at the same time that you're squatting, you're raising your blood pressure. Why? Because when you squat, let's say like this is the person's legs now. So this is the same person, and they're squatting. You see how when you squat down, it's a sharp angle here at your knees, or however the technique that you squat when you're squatting. So what that does is it cuts off that part of the body to where blood struggles to get there. What does that do? It decreases the total area of the blood vessels. And what does that do? Well, that's going to increase your peripheral resistance or your blood pressure in your systemic specifically. Why is that important? Because when you look at our example of the heart, specifically for the valve going to systemics, which this is the aorta, the aortic valve, and eventually goes to the aorta and it sends blood out into systemics. Can you imagine that if the blood pressure is higher in your systemics or your total peripheral resistance is increased, that it would be harder to send blood out of this? Does that make sense to you? Now, you would think, then that means that squatting should then decrease the loudness of an aortic stenosis, or decrease the loudness of whatever it may be. But that's not, in this case, the bigger effect, because you see, we're sending blood to the heart, but blood is also struggling to get out of the heart. So what is it doing? It's just kind of holding a bunch of blood in the heart. But basically what's going to win in this situation? It's going to be an increase in blood volume. This blood coming back to the heart basically negates the effect of increase in total peripheral resistance. So what do you need to memorize? You need to memorize this. It's going to increase your blood volume back to your heart. So what is that going to do? That's going to increase All the murmurs, same old story, increased murmurs, except for the mitral valve prolapse and hypertrophic obstructive cardiomyopathy murmur that could develop in those two situations. So it's going to increase all murmurs, except it's going to decrease the murmur intensity in these, because remember, when there's a decreased blood volume, that's when those two go up. But all the other murmurs, when you have increased blood volume across that valve, it's going to increase the murmur intensity. Okay, so now let's look at number 5. So with number 5, we're looking at something called a passive leg raise. Okay, passive leg raise. This is exactly like squatting. The only difference, this is a patient who's laying down. Passive means that somebody's doing it for you. And a doctor's going to lift his legs up. When he lifts those legs up, all of that blood in the venous system is coming rushing back into the heart. So this is going to increase your blood volume back to the heart. Okay? Now, what's the difference between passive leg raise and squatting? The difference is you're not increasing total peripheral resistance. But I told you previously that the increase in total peripheral resistance in the case of squatting really doesn't have much an effect on murmur or anything like that. So it's basically, you can treat the passive leg raise as kind of doing the same thing as squatting is. Okay? So what is a passive leg raise going to do? Is sending more blood volume back to the heart. That means more blood is being sent across all of the valves, and wherever the murmur is, it doesn't matter where in the heart, it will increase the murmur, the loudness of the murmur when you do this passive leg raise, because it has more blood rushing across it. The only two exceptions is it's going to decrease the murmur intensity of your mitral valve prolapse and hypertrophic obstructive cardiomyopathy. Okay? Now let's look at the next one. I think this may be the last one. Yes, hand grip. This is the last one. See, so it took a while when you were looking at that first one. But now that you have the general concepts, this is super easy. And why this is important, I understand I'm not going into detail on all of the way, like a crescendo, decrescendo sounding murmur, or like a mid-systolic click in mitral valve prolapse. I know I'm not going into detail on all of that. I'm expecting that you kind of looked at that already. I'm going over this because when you have a multiple choice question on the step and you don't know necessarily the answer, and they give you a detail about a maneuver, you can at least maybe eliminate 2 or 3 of the answers and then eventually get to the question. So this is why this stuff is important. You can figure things out. This comes really important too when you have a physiology. What if they ask you a physiology question about, you do a specific maneuver, what's the effect now on the total peripheral resistance? What's going to be the response of your body now to this increase in total peripheral resistance? And you can see how physiology questions can come out of this as well. Okay, so let's get back to the last one. For hand grip, all that means is you put your 2 hands together. So I don't really know how to draw this. There's one hand, okay? There's the other. You basically put your 2 hands on top of each other, and one over the other, and you tense them up as hard as you can. You generate a lot of pressure. What do you do when you're squeezing those hands together? What you're actually doing, you're increasing the total peripheral resistance. Now, think about this. We're dealing with something as simple as your hands right now, okay? We're not lifting the legs up. We're not squatting to force blood from your legs back to the heart. We're only dealing with the hands here. When you squeeze your hands as tight as you can, the effect that hand grip has is an increase in total peripheral resistance. Now, let me make this clear. This will not increase the blood coming back to the heart. It will not do that. What this thing is going to do, what you could basically say is an increase in total peripheral resistance is the same thing as saying you have an increased afterload. Now let me show you how this is going to affect the heart. Here's our heart. Here's our left atrium, left ventricle, right atrium, and right ventricle. Let's just go to the left side of the heart to keep it simple. Here's our mitral valve. And here's our aortic valve, and this aortic valve is then going to the aorta and then all out to systemic circulation, systemics, right? Okay, if you do a hand grip with a patient, it will increase the pressure out here of systemics so high that the blood coming out of the aorta will struggle to do so, and the heart will hold in more blood in this area of the heart. Okay? Why is that important? Because if the patient had, let's say for example, the patient had aortic regurgitation. Okay, aortic regurgitation. What that means is when the aorta is supposed to be closed, like, when is it supposed to be closed? It's supposed to be closed in the case of diastole, when the left ventricle is filling up with blood. That has to be closed, and the mitral valve is open because then blood can come from the left atrium and it can begin to get filled up with blood to get prepared for that valve to open up and then send it out to systole and to systemics. So in the case of aortic regurgitation, this doesn't really close all the way. This kind of remains open. So when this is supposed to be closed, blood is actually getting out of it, or going back in. In diastole, for example, there's low pressure, so blood is actually sneaking back through it again. Okay? So, but in the case of in hand grip, where you increase the pressure out here, can you imagine that this is going to force more blood through that now? Whereas it may have just been a little bit of blood before, now the pressure is so high out here, and the pressure is still small in here, that blood will go in that channel far. It's getting a little messy, sorry. So we go back to our basic drawing. Here it is. Okay, so this is an aortic regurgitation. Before, it was just basic pressure. This is the aorta going to systemics. When you do a hand grip, this goes up, the pressure, so high that it forces blood back through this during diastole way more than before. What is that going to do? That's going to increase the murmur, specifically of which one though? Well, it's going to increase the murmur for aortic regurgitation. You can see how this is not going to affect, all the other murmurs that I said before. This is affecting specifically here in the left ventricle, specifically with the aortic valve. Now let's look at the flip side. What if the patient had an aortic stenosis? Now, in the situation of aortic stenosis, when this is supposed to be opened, it's stenosed a little bit, and blood is having trouble going through it, correct? Now, what happens if it is already hard? So this is, the aorta coming from the aortic valve, and then this is going to systemic circulation again from the left ventricle. Now, it's already difficult for the blood to travel through this, right? It's already really hard for blood to go through a stenosed aortic valve into the aorta, and then into the systemic circulation. Can you imagine how much harder it would be when you have increased pressure out here because the person is squeezing their hands together as hard as they can, and they're raising their total peripheral resistance? It's going to be far harder for blood to go through that valve as it was before. What is that going to do? It's making the issue of stenosis even worse. But remember, I said, as far as murmur intensity, it's about how much blood is crossing over. So whereas you'll have an increased murmur in aortic regurgitation, you're going to decrease the intensity of the murmur for aortic stenosis. Okay? Why? Because the increase in pressure out in the systemics is making it even harder for blood to go through this halfway open stenosed aortic valve. And even with that hand grip that the patient's doing, it will decrease that murmur. Okay? So that should give you a hint. You have a decreased murmur, but it's not affecting anything else. Okay, he must be talking about aortic regurgitation or aortic stenosis, whatever the intensity, however the intensity changes. Okay? So I actually meant for this video to be a little bit shorter. I apologize for that, but I really want you to use these tips and little tricks that I've thought of to kind of make this whole really complex thing a lot easier. If this helped you in any sort of way, please leave a comment. Let me know. I always listen to feedback. I always answer to feedback. And please like, subscribe, share the channel, spread the word about this video if it helped you in any sort of way. I will see you in another video. Bye, guys.